Hi, it's Dr. Janet Pope reporting at EULAR 2021 as a room reporter for At Room Now. I wanted to talk about systemic lupus erythematosus and something that might be a practice changer for me. There was a large population-based study of patients who have a verified algorithm for a diagnosis of systemic lupus erythematosus. So they looked at people with new SLE, and then they age and sex match them from the population. This is from British Columbia in Canada, and they did a matching of about 5-to-1. So for one lupus patient, about 5 controls. And they looked at patients between 1997 to 2015. And what they looked at was the proportion of newly diagnosed patients with systemic lupus erythematosus who had their first severe infection, and they looked at infection-related mortality. So they had over 5,000 patients with lupus and over 25,000 non-lupus matched controls. These are the sobering data that they showed. So they showed the first severe infection was almost 2.6 times higher in people with lupus than matched controls. And also, very solemn, the infection mortality was about 2.2 increased compared to patients or the population who were matched. When you looked for confounding, the bottom line was new SLE had a 2-fold increase in infections and 1.6 increased mortality. And these are new patients that have probably barely been on therapy. This is an oral presentation OP0043. So why does it change my practice? I think I will be highly aware that I already knew lupus had an increased risk of infection, but serious infections causing mortality, although rare, are far more common than their age and sex match peers in the population. And I think it might be something where I will try to limit corticosteroids for this reason as well as many others. Please follow us at Room Now and enjoy the meeting.